Hi, I'm Tessa Davis. I'm a Paediatric Emergency Medicine consultant at the Royal London Hospital and I'm a senior lecturer here at QMUL. I am the Programme Director for the Paediatric Emergency Medicine MSc, and today I'm going to give you an overview of that Peds Emergency Medicine MSc, what it involves, what structure it will be, what you'll learn, how you'll be assessed, and also who you are, so who we think is going to do the course and why you would want to do the course, and importantly, what learning you're going to get out of it. So the course itself is a 3-year MSc. You could do just 1 year of the course and get a postgraduate certificate. You could do the first 2 years and get a postgraduate diploma, or do the whole 3 years and get the Paediatric Emergency Medicine MSc. What's unique about this MSc is that it's a collaboration between QMUL and Don't Forget the Bubbles. Don't Forget the Bubbles is a paediatric educational team, community, an organisation that provides knowledge translation to help clinicians make meaning out of evidence to improve their clinical practice. This collaboration will bring a unique element to this MSc, and the DFTB team will bring their unique style of engaging education, their expertise in delivering education online. And together with QMUL, we're aiming to deliver a course that's high quality, that you will want to be part of, to connect with and to engage with, and that you will be able to take the learning away, and that will result in you being able to deliver high quality clinical care to the patients you see, and that you'll be delivering that care by using critical thinking and analysis of the evidence to ensure you're delivering the best care possible. So who is this MSc for? Well, it's aiming to assist doctors, paramedics and nursing staff to develop the knowledge and the skills they need to be able to deliver excellent paediatric care to patients as they arrive into the emergency department, and that care will be based on good analysis and synthesis of the evidence base. You'll be taught to appraise and examine the evidence for interventions based on published evidence, and also integrating that with your own clinical work based on the location and resources you have available. We have different entry requirements depending on your profession, but for doctors, you will need a medical degree, you'll need 1 year of post-registration clinical training in emergency medicine or peds or anaesthetics or pre-hospital care. We will consider cases for all of these categories based on personal statement and a case-by-case basis if there's an exception. For nurses, you need an undergraduate degree at a 2-2 or above. But again, if you've got academic study below that, you would be considered if you've got strong evidence of clinical experience in a relevant medical field. And we would like you to have 2 years experience in paediatrics, in emergency medicine or in critical care nursing. For paramedics, you should have a degree in paramedic science at 2-2 or above, and similar as we mentioned before, you would be considered with academic study below this level on a case-by-case basis if you've got strong evidence of clinical experience. If you have a degree that doesn't or didn't involve clinical work, you should have 3 years experience working as a paramedic, or 1 year experience plus at least 12 months experience working as a critical care paramedic or in a HEMS system. And for physician's assistants or physician associates, you would need a degree at 2-2 or above. And again, you will be considered on an individual basis as per we've mentioned in the previous categories. And you should have 2 years experience in paediatric emergency or critical care. And these entry requirements are all outlined on the website. So what are the goals of this MSc? Well, it's designed to enable you to get an in-depth understanding of paediatric emergency medicine. So in the first module, you learn the basic skills to aid identifying reading material, reviewing papers, understanding clinical study design, and you'll use these skills from the first fundamentals of research module to help your study throughout the rest of the degree. And other modules will help you develop an in-depth and sophisticated understanding of paediatric emergency medicine. So in year 1, you've got that fundamentals of research module. You'll be learning about literature searching, study design and statistics. And then in the next 3 modules, we're going to get into the paediatric emergency medicine topics of neonatal and adolescent medicine. respiratory and cardiovascular presentations, and neurological and hematological presentations. In year 2, we're going to continue with the topics of surgical, gastrointestinal, dermatological, endocrine and renal problems. And in the final 2 modules of year 2, we're going to focus on trauma care and the care of the critically ill child. And the focus for all of these is analysing, appraising and synthesising the evidence base. And then in year 3, each student's going to complete the scientific paper module. So in semester 1, students identify a topic, they're assigned a supervisor, and they produce a 1,500 word project proposal. And then in semesters 2 and 3, they produce a 3,500 word scientific paper and also a 20-minute conference standard oral presentation. So the overall structure of this MSc is 4 modules in year 1, as we've discussed, which starts with fundamentals of research and then 3 paediatric emergency medicine modules. And then into year 2, we go on to 4 other modules. This is the surgical, gastrointestinal, derm, endocrine, renal, trauma care, and the critically ill child. And then in year 3, you have the scientific paper. So how will the learning happen? Well, module 1 is based on lectures that you will be able to watch in your own time, and then weekly tutorials, and that's the fundamentals of research module. And modules 2 to 8 are going to be structured a bit differently. So these are going to be all based on the QMUL online learning platform. And in modules 2 to 8, we're going to have weekly live sessions being run by the Don't Forget the Bubbles team. So these will run for 6 weeks of these modules, and that's modules 2 to 8, so in year 1 and year 2. And you can join live and participate in the discussion, or you can listen to these DFTB run sessions in your own time because they will all be recorded. And the next core part of these modules is your interaction on the discussion forum, because there's going to be 10 clinical questions posed in the first half of the module and another 10 in the second half of the module. These will be clinical questions based around common things that you see in your practice in paediatric emergency. So, for example, managing a baby with bronchiolitis who is looking like they have an oxygen requirement and they're working hard, thinking about should you be considering high flow? Why would you be considering high flow? Looking at the evidence base, analysing and critically appraising that, and thinking how it impacts your practice. You'll then discuss this, your answer and your thoughts on the forum discussion thread. The other students on the course will be discussing your answers and their answers, and this will all be facilitated by our faculty. So it will be a focused, facilitated, moderated discussion thread. And the beauty of this is that while understanding and appraising the evidence and gaining a deeper understanding of how to apply this to clinical practice, you'll be able to do this asynchronously in your own time on the written forum. You're going to be expected to answer a certain number of these questions, so 4 of the 10 questions that I mentioned, and you'll be expected to read the other threads and comment on them and engage in the discussion, and the faculty will engage in this discussion too. And this will facilitate group learnings and peer-to-peer learning and engagement. So this is the core parts of modules 2 to 8. And then module 3, and then year 3 as described will be the scientific paper. So how many hours is this going to take you? So you're going to take 4 15-credit compulsory modules in each year for the first 2 years. And each of these modules is going to run for 8 consecutive weeks with a 2-week break at Christmas. And for students who want to complete the MSc award, you take the 3rd and final year and you complete the 60-credit scientific paper. So each module represents 150 hours of notional study, and that's going to include self-directed reading, live sessions, discussions on the forum, assessments, assignments. Each module will consist of these 6 hours of DFTB live sessions and moderated forum discussion throughout. So the contact teaching, including the forum discussion, is approximately 30 hours, and your self-directed study should be around 120 hours per module. So that's equating to 14 hours per week. So the MSc overall, it requires a time commitment of around 600 hours annually for 3 years. How will you be assessed? So the assignment for Module 1 is going to be a short answer question, and that's going to be worth 100% of the module mark. For Modules 2 to 8, there's going to be 2 summative assessments. So one summative assessment is going to be a mid-module assignment, and that'll be creating an infographic or writing a blog post, and these will be with the aim of knowledge translation to you and your peers. And the second assignment will be either a essay at the end of the module, a short answer assignment, a critical appraisal, or a 10-minute oral presentation. So these are the two summative assignments. The mid-module assignment will be worth 20% of the mark, and the end of module assignment will be worth 80% of the mark. These assignments are going to be linked to the content, linked to the discussion, and you're going to have an assignment that will link across one or more topics. And you can use international standards, guidance, literature review, guidelines to help inform your answers. And you're going to be encouraged to share and discuss your feedback with your peers for mutual development. And then year 3, as we mentioned, is the scientific paper, where you're going to be assigned a topic and you're going to produce a 3,500 word scientific paper. The goals of all of these are to be practically applicable to your clinical practice. So that is a summary of the Paediatric Emergency Medicine MSc. It's a 3-year programme that's going to be delivered collaboratively by QMUL and DFTB using a combination of some synchronous live tutorials and discussion sessions, but also asynchronous learning on the discussion forums, all focused around practical clinical questions that we ask ourselves every day in our practice, but that you will be able to interpret the evidence and relate it to wherever it is you work in the world. So we hope you'll join us. Please get in touch if you want to answer any more questions. This MSc is going to be open for applications subject to approval by the Part 2 committee.